Well, thank you. It's a pleasure to be here for this panel. Actually, I was really looking forward to this panel and actually to the conference. We at the Department of Health are looking forward to using this as an opportunity to really learn even more about supportive housing and really to talk with all of you about your experiences as we look forward to what we think is going to be a very exciting period of reform and change and innovation in the way services are provided to the Medicaid patients into the future. We see, as I mentioned earlier this morning, we see supportive housing as a vital strategy in an array of strategies associated with trying to achieve what we see as the ultimate win-win, which is we see patients getting with better outcomes, people staying healthier longer, people living in more appropriate settings, and overall improvements in the quality of life. And as a result of those efforts, we are also seeing cost containment and really a bending in the cost curve in the Medicaid program. I guess my role today is just to give you a sense of an overview of how we got here and where we're going in the future with regards to redesigning Medicaid in New York. As I mentioned, this has been a year-and-a-half odyssey since the governor created the Medicaid redesign team and really gave that team a twofold charge. First and foremost, find immediate in-year savings, over $2 billion in savings in state share. That's asked to take about $4 billion total spending out of the healthcare sector in the state of New York without creating huge problems and consternation, and see if you can try to find a way to get everybody to agree to those changes. That was task number one, and we were given about a little less than 3 months to accomplish it. And then the second task was the task that the team really was most excited about, which was mentioned earlier. Was to really spend time diving into some of the more complex issues, try to come out of that process with a comprehensive multi-year reform strategy. As a part of that strategy, we broke the team up into 10 work groups. We invited 175 additional stakeholders to become part of this dialogue. With the MRT, it's really been a focus of not so much the state going behind closed doors, figuring out some new policy initiative, and then releasing it in some speech and telling everybody this is the way it's going to be, it's our way or the highway. With MRT, it's really been, and we've been serious about this, and I don't know if everybody believed us when we started, but I hope the final report shows it, that we really did want to engage stakeholders and hear about what people thought was the right, best direction for the state moving forward. How could we achieve our win-win scenario? And it was out of that process that the state's changed its view with regards to the role of supportive housing in Medicaid. And so what we have now is, and I encourage anyone who hasn't seen it, I know our website, if you go to our MRT website, there are lots and lots and lots of presentations and PowerPoint slides. Never quite added them all up yet, but there are thousands. But on that website, you'll see one very important document, which is the final report of the MRT. It's a little long, it's about 35 pages, but I encourage people to look at it because it really, I hope, lays out the general strategic direction that the state wants to go with Medicaid over the next 3 to 5 years. As a tool in achieving that goal and objective, we also announced earlier this week, the governor announced that we are going to be pursuing a new, we think really groundbreaking 1115 Medicaid waiver with the federal government. It's a new sort of relationship between the state and the federal government in terms of how the Medicaid program is administered in our state. And a big part of that is our push to tell the federal government that because of the MRT, we're going to be saving you substantial amounts of money, and we'd like to have the opportunity to be able to reinvest some of those dollars back into New York, into areas like supportive housing, where we know that we can further improve patient outcomes, we can further bend the cost curve if we only had some additional seed capital that we could to reinvest into the system. I think our argument to the federal government is a strong one. Over the next 5 years, we're going to save them about $17.1 billion. That is not chump change even at the federal level. To give you a sense of the magnitude of what we're talking about here is that thanks to the MRT and the fiscal year we just ended, we saved the federal government in actual spending about a little over $2 billion. And that was enough savings to flatline the national growth rate in Medicaid. That is, thank you. It's the work of a ton of people who went into this, including many of you in this room. But it just shows you, one, the size and magnitude of the MRT effort, but also the size and magnitude of the New York State Medicaid program, the nation's largest. And so when we do things right, we can actually help the budget deficit situation, and when we do things wrong, it has national implications. And so I think that as a result, we think we have an opportunity to have a discussion that other states maybe haven't quite been able to accomplish. I would say that in the case of supportive housing, we are going to have the federal government, and to a great extent, change its paradigm as much as we at the state have changed our paradigm in terms of the role that supportive housing plays in providing high-quality health care services and supportive services to the Medicaid patients. That is really our collective challenge. I said this to Ted just a little while ago, that we're going to have to convince the federal government that their view of housing in terms of Medicaid financing needs to change. The federal government, since the creation of Medicaid, had no problem. In fact, it was an entitlement level of coverage that if someone needed a nursing home, we could pay for that. And we do pay for that to the tune of about $6 billion a year. So the question is, can we redefine what housing is so that we can actually pay for housing that's less expensive than nursing homes, that's more in line with the needs of the patients, that's consistent with the Olmstead decision, and is also, at the end of the day, what people want in order to live the kind of lives that they want to live in independence. Can we not find a way to redefine the housing equation in a way that achieves, I think, what the wants and needs of the patients are, as well as what makes the best budgetary sense? And really, fundamentally, at the end of the day, that's what our waiver discussion with the federal government is. We've already begun this discussion. We think that there's receptivity to it, but we are going to have to think creatively about how we will be able to potentially use these waiver dollars to expand the stock and improve the quality of supportive housing in the state of New York. If we can think creatively, we can work with our federal partners, we can come up with a plan that they can endorse, this could potentially mean hundreds of millions of dollars of new investment in supportive housing. A bigger increase in supportive housing investment than this state or any state's ever seen, and that's the opportunity for us. But that means that we're going to have to think very, very creatively. And I look forward to working with all of you and through your association in the coming months in terms of how we put that case together. Because I do think this is once-in-a-lifetime opportunity. At least that's what I say to all my employees who are amazingly overworked with a 42% vacancy rate in our organization. But that's why we should all be excited to work 60-hour weeks, because it is just one of those times. And for those of you who have been in public service, and I've been in my entire career, there are not that many times you come along where you have really an opportunity to fundamentally change something, particularly something as important as Medicaid in New York with the 5 million people who depend on this program every day. So we're very excited and look forward to working with you over the next several months as we prepare our official waiver request. The second and last thing I want to mention is that one of the other challenges we have, and we'll talk a little bit about this, is the state through MRT has launched a number of different strategies really designed at providing enhanced care management, better care coordination for Medicaid members, particularly our highest cost, highest needs members. Supportive housing is one such initiative. Health homes is another type of initiative. And also the move away from fee-for-service to care management for all, contracting with organizations who have the ability to look across the entire needs of an individual and put together individualized care plans that are unique, that allow them to individuals to better have their life aspirations achieved, their health better managed, and hopefully a more cost-effective system overall. Those are all important strategies that together over the next several years, as we roll this out, we have to work together to make sure that we protect what's good about the current system and address the issues and the problems that exist within the current system. While there's a lot of great things, and we're celebrating a number of those things here today, there are challenges that remain, significant structural challenges that remain in the New York State healthcare delivery system that is something that we collectively have to work on. First and foremost, New York ranks 50th in the nation when it comes to inappropriate hospitalizations. That means there are more people going into hospitals and emergency rooms unnecessarily than anywhere else in the country. And that is a key reason why we spend so much money on our Medicaid program and overall in healthcare. And that, to me, is really one of those things that together this new system needs to fundamentally address. That's why in health homes, the #1 measures for health home performance are reduced hospitalizations, reduced ED visits. And we have to be very focused on that. And the second statistic that I would mention is right now in our long-term care system, roughly 50% of the money is spent on nursing homes. Nursing homes are important. We will need them well into the future. However, if you look at other states, and I'll mention one, Arizona, which is the only state in the country that's had managed care, and I know lots of concerns about managed care and what it means, but they're the only state that's had managed care since the program was created. In New York, they have an 80-20 split. 80% of their money is spent on home and community-based programs. 20% is spent on nursing homes. And the reason for that is when you better align the financial incentives in the delivery system and you actually reward people working with members to provide the services in the most cost-effective settings, what you end up, particularly in long-term care, is a very different result than what we have in our traditionally fee-for-service system, which is heavy reliance on institutions is where we have it, and you have a much more Olmstead-friendly or Olmstead-consistent outcome with regards to a higher reliance, a greater reliance on home and community-based settings. In order for us, however, to get to a ratio similar to Arizona, we're going to need more housing options. And one of the key things that we heard over and over again during that early days of MRT was that a major challenge, a major reason why people are in institutions today, particularly in urban areas such as New York City, is that there are not affordable options for them in the community. There are not the kinds of housing options. There are options, but there just aren't flat out enough of them. And it was really that, plus actually seeing some of these options, which is what really convinced us to pursue, as part of the Medicaid redesign team efforts, a substantial increase in supportive housing. So I am very excited to be here today. Liz Misa, who was recently hired as the deputy for the Office of Health Insurance Programs, which I run, is going to be our point person on supportive housing. It shows you just how important this is, that the overall office deputy is going to be charged with leading this effort. Mark Kissinger is going to be here, who's also been working tirelessly on this in addition to a lot of other things on his plate later today. So we look forward to a dialogue where hopefully we can answer questions, but we also can hear from you in terms of your thoughts about how to implement the ambitious MRT agenda.